Make America healthy again. That's what Trump is promising to do in the next 4 years. The US has always had a bad track record in public health. Millions lack access to basic healthcare, and costs are at an all-time high, making many just one medical emergency away from bankruptcy. But how will things look on day one for the new administration?
The new administration is going to walk in the door with an enormous agenda that it already exists on health. The United States spends the most of the other industrialized nations, and we are at the bottom in terms of health outcomes of the other industrialized nations. So we're not getting the best value for our dollar. The truth is that one of the most important issues that the administration is going to have to address is continuing rising healthcare costs.
For this, Trump's pinning his hopes on a rather divisive figure, Robert F. Kennedy Jr. Trump wants him as health secretary, a post that will put Kennedy in charge of roughly 80,000 employees and a $1 trillion budget. Known for his views that many would call extreme, Kennedy wants to make sweeping changes in how Americans eat, drink, and stay healthy.
Mr. Kennedy has articulated an effort to remove fluoride from our water. We also know that he has been a known vaccine skeptic. In fact, vaccine skepticism is probably too soft a word. He's anti-vaccine in his articulation and his behavior over many years.
Polarizing opinions aside, RFK, if and when he gets congressional approval to be the next health secretary, will have two pressing issues to address: the opioid crisis and the unchecked march of chronic disease afflicting millions of Americans. Currently, drug overdose is the leading cause of injury mortality in the United States, with 82,000 killed by opioids in 2022 alone, according to the CDC. Trump's earlier attempt to remedy what became a public health emergency in 2017 proved less than conclusive, as according to experts, the root causes of opioid addiction was not addressed.
We're going to have to address some of the programs in communities that were really challenged, some of which voted for President Trump, by the way, and they're going to have to reverse some of the economic reasons that people went to drugs in the first place in those communities. But it's going to require a very strong investment of both programs and, of course, money to make that happen. I point that out because the president has said his top priority is to not put money in programs, but to get a tax cut.
Depression, diabetes, and asthma. According to US data, around 112 million adults, that's around 1 in every 3 people, had one of these chronic diseases in 2022, a major burden on the country's healthcare. Adding to this is an escalating number of people unable to access enough food reliably year-round. In 2023, 47.4 million people across the country lived in food-insecure households, a major public health priority, but one that may face hurdles getting the funding it needs in Republican circles.
I would argue that the most important priority, the top priority ought to be, is the number of people who are food insecure. Tragically, however, the president's party has been opposed to adding those dollars, and in fact, are looking at those fund sources for those programs as a way to pay for his tax cuts. So again, another one of those policy conflicts that's going to have to occur very early on.
In addition to his views on vaccines and fluoride, Kennedy is known for his opposition to processed foods and additives, setting him at odds with the US Department of Agriculture, which heavily invests in the production of key ingredients for ultra-processed foods. Since 1995, over $500 billion have been given as subsidies to farmers in the US. Much of this went towards growing corn, soy, and wheat, key ingredients in highly processed foods consumed at an ever-growing rate.
Also, the food industry, big food we call them, is a very, very powerful lobbying group. In addition, the president's party is going to have to take on the farmers in the United States, because a lot of the foods that feed into the unhealthy foods that we serve kids in our lunch program are prioritized and promoted by some of the farmers. We give farm subsidies for things like sugar in the country.
Getting these farmers on board may prove a big challenge for Kennedy.
Getting people down to ideal body weight and addressing chronic diseases is not rocket science. We actually know how to do it. But it does require investing in public education programs. It requires us changing what we eat and these incentives for eating. And that may very well mean government subsidies in order to bring down the cost, or things like tax credits.